everyone. Myself, Dr. Shamsa. I'm working as a professor and head of the Department of Shalakya Tantra, National Institute of Ayurveda, Jaipur. I have 22 years of teaching experience for undergraduate and postgraduate students and 10 years in PhD studies. So my career started in 1997 when I did my undergraduation from BAMS from Government Ayurveda Medical College, Mysore, and my post graduation from Government Ayurveda Medical College, Bangalore in 2001. And later on, I joined SDM College of Ayurveda, Hassan, as I was the first postgraduate teacher to join this institute. And after that, again, I continued my PhD studies from Tilak Maharashtra Vidyapit, Pune. So my ambition as a child was to become a doctor, which I have achieved. And my mission is to take this branch of Shalakya Tantra to a very high level and to upgrade it and set it as a good science for treating the diseases in ear, nose, throat, and head. So I have achieved a lot during my life, and I have a vast experience in research, in academics, and in clinical field. So I have conducted, after coming to NIA, I started developed the Kriya Kalp department. Previously, it was running under the name of Sridharyam. So after I joined SDM, after I came to NIA, I started this Kriya Kalp unit, then eye exercise unit, and new infrastructure was added on to this institute, and now we have the latest infrastructure like OCTs, then perimeter, etc. And we have full-fledged ENT OPD, and I have a good number of patients in eye, like 70 to 80 patients. Sometimes it comes to even 100 patients. And the thing is, which I'm very happy, is that the patients who approach to me are from different parts of the country, and sometimes even I have 2-3 patients who have come from abroad, and they have got very good success. So the diseases which are not curable in allopathic science, those diseases we can cure with Ayurveda treatments. So I have got very nice success stories, and I have my own YouTube channel, which and you can see this channel, and because I have added all my radio talks and my other activities which we are been doing in this department. So you can see that I have 71 publications in my account, and I have a book also on concept of glaucoma. So my area was of interest was glaucoma, and when I took up my post graduation course, so my this aim was to do post graduation only in Shalakya Tantra, and I had also selected the disease, that is RP. So right now I am treating a patient of RP who is additional director of income tax department, and husband is also a IAS officer. So we have very good patients who are coming from high profile patients, and also one patient who is a textile owner in Jaipur, having a showroom also, a full-fledged showroom. So in that way, patients, even though it's a government setup, the patients come to us for getting cured, even though we don't have that much infrastructure like a spa-like infrastructure as available in other centers. And I was also very lucky enough to be a resource person in an international conference which was held in London in the year 2014, and I interacted with all the students, and I gave a talk on Ayurveda for the health of sense organs. And also I had the opportunity to visit Colombo, Sri Lanka as a resource person, wherein I gave a talk on Dhumapan in nasal, concept of Dhumapan in nasal diseases. So I have given many lectures as a resource person in many national and international conferences, and also given keynote lectures, and as a chairperson I have chaired many scientific sessions, and also I was the judge in many of the paper presentations of students. And also I'm very lucky to give radio talks on different aspects. So I think few radio talks which I have saved are available, and I have been awarded with many awards. Like the recent one is Ayush Amritam, wherein academic excellence in Ayurveda field and academic excellence in education. So all these awards are in my credit. And during the times of COVID, I had the opportunity to deliver various guest lectures in different parts of the country on different topics. And really, it was very good for me to interact with students during this critical time. And also, these are some of the radio talks which I have given on various concepts in Rajasthan Patrika, and also TV talks, and as well as I have given many this thing public awareness programs. So this is in order to take care of the senses, how we can best utilize the vision. One thing what I would like to share is the patients who come to our OPD, they come for improving their vision. So that is the message which has gone to the public, that we can improve our vision through Ayurveda. And those who want to pass the exams in defense and who have defective vision, they come to us, and they will very happily, they will qualify in the in those exams. And I have so many patients who have shared their feedback after the treatment here. So that is what we want to achieve, that is we want to bring the vision to normalcy, so and bring a smile back onto the patient. And I also had the opportunity to attend many training programs in Delhi, in and then in Jamnagar, and all over the country. And further, so in that way, I have a lot of academic excellence in my this thing. So what I have also done many CMEs in our hospital on various topics. So I have selected critical topics like deafness, then retinal diseases, macular edema, etc., in order to understand it in a better way through professionals. And we, during the times of COVID, we have also organized a webinar on Drushtigat Rogas, and also recently we organized a webinar, international webinar on updates in Shalakya Tantra. And in September 2021, we also had the opportunity to conduct a 6 days training program for all the teachers of Shalakya Tantra. It was a big success, and the trainees were really very happy, and they could get a lot of feedback. And we have one of the best infrastructure in our hospital, and we are, even though we are having less space, but we are giving more teaching and training and facilities to the public. So we every day we are displaying the eye exercises in our unit, so that the patients who are sitting for their consultation can be upgraded with the techniques which they can practice easily at home. So these Nitra Kriya Kalpas are very well practiced, and all the latest procedures are all the procedures are done in our OPD, and we have got very tremendous result. And our we have 50 to 60 procedures per day, and each patient will receive many procedures depending upon the disease. And we have a lot of success stories, as I told you, that especially in case of diplopia patient, he was really, he was not treated in many centers like AIMS, Bhopal, and he came from Gwalior, etc. But after coming to our hospital, in 2 months treatment, his vision returned to normal, which was 6 by 24. It came to 6 by 6, and at the same time, his diplopia vanished, and the patient is so happy. You can see his feedback on my YouTube channel. And there was one more patient who came from Singapore. She also had this scleritis and there was a lot of congestion in the eyes, and the patient was watering, and all the symptoms, acute symptoms were there, and she used to take continuous steroids. And even after taking steroids, there was no response. But with Ayurvedic treatment and with Kriya Kalpa, there was complete recovery. And one more patient who had Meniere's disease, and he had severe giddiness, and he had to take those medicines continuously. But after taking our treatment, he got tremendous result. So one more patient I would like to mention is one who came from Kerala, who had 25 years of headache, and we could give complete recovery to the patient. All these videos are there. So we have a good number of statistics. You can see the 5-year statistics in Kriya Kalpas. And we have set the eye exercise unit also, wherein we do all the routine exercises for all the patients for the betterment of the vision. And we have also displayed the various charts, etc., in our unit, so that patients can get a lot of information. And we have some handouts in order to take care of the senses. We give the handouts to each and every patient, so that when they are taking the procedure also, they get the required information, how they should take the patya, apatya, etc. So all this daily have been doing. Every day for me is a new day. So I would like to add something new to the department. So some new procedure or something new should be done. So that is what my mission is, to do new things and new endeavors, and not only in the field of Shalakya Tantra but in other matters also. And that is what I like to see in the patients, and I also advise them. So we also do many parasurgical procedures. You can see very good success rate in this, even parenchymatous tonsillitis, fibrotic tonsillitis, and follicular tonsillitis. With Sharakarma we have got tremendous result, and I have whatever result I see, I give those topics to my students. And definitely even after the research work is over, the patients come for the treatment. And the name and fame usually spreads by mouth. So it is not publicity, is through the patients itself. And when they get good recovery, they send patients from different the parts of the country, they come to us. So gradually our count has increased. So that's, and some new procedures have also been added, like this nasa pichu in case of nasa pratinaha, that is deviated nasal septum. We get very good result. And this karna basti is also one procedure which we can practice in case of rigidity of the lower jaw, anugraha, or in case of sensory neural hearing loss. This procedure is very good. And few small simple eye drops are also prepared in the OPD, because we have numerous formulations in our text, but it is not explored, and most of those preparations are not available in the market. So I also motivate my students to prepare new preparations and new yoga, so that we can add on to our science and we can see its efficacy in different diseases. So these are just a few, and daily I ask my students to prepare, to come up with new preparations. And this was a case of inverted papilloma, which we have treated through Agni Karma. So these are some of the success stories I have in my YouTube channel. And this was also a very interesting case of ranula. This girl was a IT professional. She was from Rajasthan, but she went to Bangalore for her job. But because of this repeated pus discharge, she had this ranula, and because of that there was repeated pus discharge, and the patient was so depressed with that. She underwent multiple operations, but then too there was recurrence. But only with 2 sittings of Sharakarma, I could give complete relief to the patient. This is the patient of headache of which I was talking about. And I have also attended many camps outside the campus, and I take care to see that all the different camps are also conducted in house. Like we celebrate the glaucoma week, the World Sight Day every year, and that's how we, like on different diseases we will be keeping camps, so that there is a lot of awareness among the public, and on different aspects. Especially my target is to treat those diseases wherein there is no treatment in modern science, like macular edema, optic atrophy, and ARMD, and also retinitis pigmentosa. And also we have conducted 1 week camp on Jalandhar Bandha, and that it was a painless method of tooth extraction. That was also a big success. So we had many patients in this during this time. So that is what I would like to take new endeavors. And one more interesting camp was, we usually conduct it in this Rajasthan Netrahina Kendra, that is a blind school. So these students, we go there and do free checkups, eye and ENT checkups, and give them medicine. So these people will be very happy. And also we can see how I want to show the students how these blind children, how they will adapt themselves. And we should be very happy that we have good senses, and we should appreciate this in our life. So that's why we should take care of our senses. And also we had a very interesting camp on pain management. For 3 days we did, and we only it was pain was regarding the ENT and the dental pain, as well as the eye pain. So different pains were categorized, and different medical treatments were given, or different therapies were given immediately, and the patient used to get relief during the camp days. and we have made these patient information tools also for them as handouts, so that it will be easy for them. And what are the netra hita dravyas, that also is displayed during this camp, so that patients are aware and they take care of their proper diet. And these are the some of the glimpses of the CMEs which we have held on different topics. And usually these awareness programs are very important in order to upgrade our knowledge, not only our knowledge but also the students. They will also be motivated, and this type of academic activities are very important. So that's why during COVID times we couldn't organize much camps, but we conducted many webinars. So the topics, while selecting the topics, care is taken that those topics wherein there is lacuna, so those topics are being selected. And in public awareness program we did a outreach activity for the people in near Jal Mahal, and it was also a big success. And eye care through Ayurveda is also a very important topic. So that's why I did a donation awareness program, and how we can take care of our eyes, that also was done in our auditorium, and it was organized for the public also. So these are some of the TV talks. And so in that way, we also celebrate some of the important events, like the Women's Day, then the Hindi Divas, and also participate in extracurricular activities like this food festival, wherein we prepare some new dishes which are good for the eyes, ENT, etc., or the sense organs. And it was during this food festival, it was a good success. And also I have participated in sports, and that is I was a part of the cricket team of women's, and team also won. I have some publications, and I have a book into my account. I have already told this. So in this way, what I would my message to the students is to be motivated and to be disciplined, and to be have a positive energy. Never have negative thoughts revolve around you, because when you are approach everyone with positivity, then you can even motivate the others. So you should in yourself be an inspiration, so that the others are also inspired. And if you carry negative thoughts and negative feelings, the others will not be inspired. So each day of your life is precious, so you spend your day effectively. Even each second of your life matters, because you will never get that second back in our life. So that is what I feel. So my message to the students is to be self-disciplined and to be good. Because you should be a good human being, a good doctor, a good physician, a good clinician, and also you also should manage your family life efficiently. And at the same time, you should have some hobby to keep you motivated, because sometimes when you have hobbies, you feel that when you are stressed out, you can relax. So my hobby is gardening, then arts and crafts, painting. And I feel very happy when I spend time in these activities. So then so I want all of you to be very energetic in your life. Don't be depressed, don't encourage such thoughts. And my this thing is message is to be happy, good and gay. Do a good deed every day. And good, better, best. Never let them rest until the good is better, and the better the best. And do good to all the people you can, to all in at all the places you can, and to everyone you can. So that is how you should become. You should carry goodness in you, so that you are as a whole individual, you are develop as a whole individual into a good person, and everyone will appreciate your efforts. So that is what. Thank you for giving me an opportunity in participating in women's program on online mode. So my institute, dream institute, was SDM College of Ayurveda, Hassan. So when I saw this institute, I was in love with this institute, because when I was doing my PG, so I was always wanted to work in a place which had a lot of greenery, and which had very good infrastructure, and which was very clean. So that was my ambition during that time. And there was no such college, so all my friends used to tease me that for you, there is no such college where you want to work in such an institute. But I used to tell them that for my sake, such a college will come up. And when I really saw SDM college, I was not interested to go to Hassan, even though it is my in-laws place. But I was in love with the institution. So I had spent my 10 years in this institution, were very happy, and I could learn much in my life, and it was a stepping stone to my career ahead. And it is, I'm very much happy, and I'm very thankful to our principal, Dr. Prasanna and Rao, who has motivated and encouraged and inspired me. And I thank everyone, the SDM institution, also staff, and the management. Thank you.